I went on vacation, got home, and there was a bill for $100,000. How in the world did that happen? Well, I'm Yvonne, your host of Wild Travels. And don't forget to like, share, and subscribe to the channel, as I always say. And this is actually part two of a medical emergency abroad and how these things can happen and when travel just goes wrong. And so if you watched part one, if you've not done that, please go back and watch part one. I shared just a heartbreaking story of a mom and a daughter that went on vacation, and certainly it just did not turn out the way they had planned. And so in this segment, I wanted to go over the importance of wrapping travel insurance anytime you're going to be traveling abroad. So your health insurance probably is not going to cover you outside of the United States or outside of whatever country you are from. So you'll just need to check the rules there or with your insurer. But many international travelers are shocked to learn that when they are abroad, should there be a medical emergency, they're not covered. And even if they are covered, again, it's going to be subject to deductible and co-insurance. Here in the U.S., we have the U.S. Social Security Medicare program, covers nothing. Absolutely nothing. So if you're on that program and you are traveling abroad and you have a medical emergency, it is going to be all out of pocket. In most countries, your government is not going to pay for your medical bills. So it's really crucial that if I'm working with you or whoever you're working with, of course, I always wrap it in. I don't even give it a question. And if, as I said in the other video, if my client chooses not to accept the travel insurance, I have them sign a waiver stating so, and just, for my records. So if you are in a country and you need to have medical services, more than likely, even if by chance your insurer will cover it, that is going to be on the basis of reimbursement. Meaning, once you get back home and you're able to communicate with your insurance company, you will then need to file a claim for reimbursement, which means you've already paid or had to pay up front for the medical bills wherever or whichever provider is servicing you abroad. So one of the things that you can do is the staff at the U.S. consulate can direct you to facilities in that area. They can help you with wire transfers should you need to provide funds, cash funds to that provider. They'll contact your family for you. So definitely get in touch with the U.S. consulate in whatever country that you are in. Now, again, I can't stress enough, if you decide to travel without the proper insurance, you will need to pay for these charges up front. They assume that once you're all patched up and better and you go home, they're never going to see you again. And so, they'll just want to request that information up front. There's one instance not long ago where the individual had actually purchased the proper insurance, had a medical emergency, and took documentation to the provider that he had the insurance. Well, the provider still wanted a $10,000. $10,000, that was just an upfront deposit for his medical care. Thankfully, he was able to contact the travel insurance company with whom he'd made the policy, and they actually upfronted him the $10,000. So there was nothing out of pocket. And then once he got home, he was able to file a claim, and the travel company and I'm very familiar with them, was able to go ahead and take care of. So again, it really depends on your company. Just make sure you're with a company that is willing to work with you as well as the provider. So main thing here, you don't leave the country without the travel insurance. I mean, as I said in the other video, insurance is not something that you call your friends over and have dinner and toast and have a drink and say, look what I bought. However, those pictures and all that fun you had is not going to mean anything if you get there and have a medical emergency and it ends up costing you thousands and thousands of dollars, or it's trauma on your family, or they can't get to you, you can't get back home to be, if you have to be evacuated. It's just a horrible, horrible situation. So a couple things real quick I want you to keep up with. I want you to do a couple things. Confirm with your insurance company the extent of your coverage before you leave your country. Okay, and they'll let you know what you need to do. They'll go over the plan with you. Just get someone on the phone, and they'll help you with the procedure of submitting any claims should you need to have a claim submitted. There's travel insurance, and then, of course, and then there's medical evacuation. I always wrap it in. I wrap them both in. Travel evacuation the cost can be up to $100,000. And I know what I'm talking about. I've seen the claims. So please, please just go ahead and get that extended comprehensive coverage. Write down the addresses and phone numbers, as I already said, of the U.S. consulate. Bring a letter from your doctor if you are on any special medication, and also the diagnosis and the name of those medications, as well as any generic names, as drugs vary from country to country. So should you get there and have a medical emergency and you've got this letter from your doctor, especially if you're under his care, they'll know immediately what to do. Always bring your insurance card, okay, and a claim form information. All right, and the phone numbers where you'll be using your individual insurance policy or a travel insurance policy. And I already stated in video number 1 to leave a copy of that behind with the individual whose name is on your passport, because more than likely that is the individual that will be called should there be a medical emergency. And again, be sure that information, whoever that individual is, my next item is their name and information is clearly on the passport. We already stated researching the hospitals. We all know hospitals are not the same, so do keep that in mind. The reason I mentioned, and I'm going to jump back real quick to comprehensive, is because suppose there's some sort of an unrest in that country and you need to be evacuated, or perhaps there's a natural disaster and you need to be evacuated out of that country. So it goes beyond a medical need. So please, please be sure that you wrap that into your budget for, $200, maybe a little more, depending on all who's traveling with you and how many people. But I cannot stress enough, you guys, to please, please be prepared for a medical or a natural disaster or some type of a civil unrest, and you want to get yourself and your family safely out of that country and back home. Thank you again for watching. Thank you again for sticking with me. I'm just getting to know all of you guys and all of your messages, and so I'm working as hard as I can to address all of these situations. And you guys travel safely. That's my last one. Travel safely, and we will see you next time here on Wild Travels. Bye-bye, everybody.